Good afternoon, everyone. Thank you so much for joining today's webinar on Getting Outside the Clinic, Expanding Hepatitis Testing Through Non-Traditional Partners and Settings. My name is Melissa Kitlis, and I'm a manager on the hepatitis team at NASTAD. And for those of you who aren't familiar with NASTAD, we are a nonprofit association that supports state and city health department HIV and hepatitis programs through capacity building assistance as well as advocacy and policy work. And we do all of our work through the lens of social justice. And this webinar is being put on today by a coalition that we run called the Hepatitis Testing Partnership, which is a group of stakeholders including health departments, community-based organizations, academia, community members, and others who are interested or are currently working to increase testing and linkage to care. This group convenes virtually through quarterly webinars like the one you're on today, as well as through a listserv where we share resources, different materials, requests for information, etc., on a range of topics related to testing and linkage to care. So if you have any partners who you know might be interested in joining that coalition, please let us know and we can get them connected. And we decide on our webinar topics based on feedback that we receive either through questions that come up on the listserv or through evaluations for our webinars. So please, if you have topics that you'd like to see on a future webinar, include that in the evaluation that's at the end of the webinar that we're on today. Some topics that have come up that might be showing up soon on a future webinar include testing in emergency departments, as well as peer-based models for linkage and navigation to care. So just to kind of put out that teaser for future topics and webinars that we'll be hosting. And before I go into the housekeeping items and introduce our speakers today, I just wanted to provide a little context about why we're discussing testing outside of the clinic setting. So as I'm sure most of you know, only about 1/3 of people living with hepatitis B in the United States and about half of the people living with hepatitis C are aware of their status. So we're missing a large portion of people who need to be diagnosed and navigated across the continuum to treatment and cure. And the majority of the people that we're missing in clinical settings are those who don't have access to care. And there are a lot of settings that I know we all are working on in, such as syringe service programs and opioid substitution treatment and others that are key to community-based testing. And particularly as we look at increasing people who are diagnosed and engaged in care, and as we work towards elimination, there's a need to be creative and get even further outside of the clinic setting and get into places in the community and meet people who are most affected by hepatitis where they're at. So that's what we wanted to talk about today. And we're going to hear from 3 great speakers who are going to share about their programs working in non-traditional settings, from state fairs and nail salons and restaurants to working with new and non-traditional partners such as faith communities to increase testing and linkage to care and really expand access to hepatitis programming. And we recognize that this list of non-traditional settings is non-exhaustive. We're just covering a few examples. So one thing I would love to hear from you all on the webinar through the chat box at any point during the webinar is just, are there additional settings where you're doing testing and hepatitis work that you found to be really successful, or are there venues that you're exploring and are interested in learning more about? So one example of something that came up after I sent out the memo for this webinar was someone who is interested in doing both hepatitis testing and overdose prevention work in libraries and wasn't sure if anyone else was doing something similar and what they have learned through those efforts. So we love for this to be more of a conversation and dialogue, so feel free to use that chat box to share about the work you're doing as well. So before we get started and introduce the speakers, I'm just going to cover a few quick housekeeping items to let you know how you can participate in today's webinar. But on the screen, we shared the call-in options if you haven't been able to connect already via phone. And we'll just note that all lines are muted. And we're going to have this webinar in listen-only mode, but really want you to use the chat box or the question box on the right-hand panel of your screen to share examples from your work or ask questions and engage there. And today's webinar is being recorded, so you'll receive an email with a link to that recording as well as a copy of the slides following the webinar. So now I'm going to turn it over to my colleague Jasmine West, who is co-facilitating with me today, and she will introduce our speakers. And I didn't mention this, but I wanted to also share that we should have about 10 to 15 minutes at the end of the webinar for questions and discussion. And if there's anything we don't get to then, we'll make sure to follow up after the webinar to make sure you get your questions answered. So Jasmine, I'll turn it over to you.
Great, thanks Alyssa. Hi everyone, thanks for joining. This is Jasmine West. I'm a senior associate on NASTAD's hepatitis team. And thanks to the willingness and generosity to our speakers, we have Courtney Hampton from the Arkansas Department of Health, and she'll speak to the 2018 State Fair testing event and a forecast into 2019. Followed by Jane Pan from HBI DC, and she'll speak to innovative outreach initiatives for hepatitis testing. And then we will also have Wayne Smith from Samaritan Ministry, where they'll highlight 2 different partnership models that they've worked on to date. So I'd like to thank them again, and Courtney, we will turn it over to you so you can get us started.
Good afternoon. Thanks, Jasmine. So I'm going to talk to you a little bit about our outreach efforts with our state fair, and that was in 2018. Next slide, please. So the learning objectives are to provide an overview of the Arkansas Department of Health State Fair testing event in 2018, to highlight successes and challenges with planning the event, and also to discuss some next steps for our 2019 testing event. Next slide, please. So the Arkansas Department of Health began testing at our Arkansas State Fair around 2014. During that time, we were only doing education and outreach, and we had a fair booth. In 2017, we reached out to the State Fair and said, hey, we want to offer HIV testing. They told us that there was not space for testing there. So in 2018, we plan to have an off-site testing event during the same time as the fair. Now, the fair is, in Arkansas, we have a 2-week period. It's from October the 11th through the 20th, and we partnered with agencies and provided testing for not only hepatitis C, but for HIV, gonorrhea, and chlamydia as well. The off-site testing event was held at the Little Rock Compassion Center, which is a homeless center in Little Rock, Arkansas. Next slide, please. So what was extremely important with planning this event was the preparation and training. Planning for this event and planning and trying to find a location actually began around March of 2018. Prevention staff went out together. We got one of the company vans and we all jumped in and we went out and we surveyed and canvassed the neighborhood to try to find the correct venue to have this testing event. HIV prevention trainer, she worked fearlessly to find vendors, to find quotes, and we had to find quotes for rental of a tent, generator, and also portapotties for the STD testing. We held a mandatory training for all participants a week before the testing event. We also provided a hepatitis C testing and education training for individuals who assisted with the event. Next slide, please. So you'll see this picture here, and this is a picture of not only the HIV prevention program, but also the Ryan White program, and also our program nurse. So it was an all hands on deck event, and everyone participated. Next slide. This is actually a picture of the tent. This is a 20 by 20 tent. And you see our branded Know Now logo on the side of it. Next slide, please. This is the inside of the tent, and you see the table. The table that you see there is our registration table, and the chairs adjacent to the registration table is one of our waiting rooms. Next slide, please. Here is a picture of one of our funded hepatitis C community-based organizations, Ashley Young, and she's doing an example of how to administer a hepatitis C test. Next slide, please. Here's another picture of the outside, the back of the tent. So right next to the back of the tent is a picture where the porta-potties were located. And unfortunately, we don't have a picture of the porta-potties, but they were located in that area. Next slide, please. Here's a picture of our HIV prevention field operations manager, and she is inside the fair. So what we did to try to get people to come to the off-site testing event was we had a booth inside the fair. Inside the fair, we handed out pieces of paper that were referral cards so individuals could leave the fair and go to the off-site testing event and get tested. In addition to the cards, if an individual got tested for hepatitis C, HIV, gonorrhea, and chlamydia, they were given a $10 gift certificate, a $10 gift card. So that was a huge incentive for people to get tested. Next slide, please. Here's a picture of one of the cross-directional signs. We had these signs posted all over the Little Rock area to lead people to where the testing was, because the testing was off-site and away from the fair. We wanted to make sure that there were no barriers to getting tested. Next slide, please. Here's another picture of another cross-directional sign showing individuals where they should go to get tested. Next slide, please. And here is a picture of the referral cards that were given out in the hall, in the actual testing, in the actual outreach area, at the state fair. And we gave these cards to individuals. And we also measured the number of individuals that actually came to the state fair from our card versus number of individuals that came to the state fair from our advertisement. Next slide, please. Here is a picture of our community-based organizations and our grantees, as well as our disease intervention specialists. And this is the training that we had the week before the testing event. This was very important in the preparation of the testing event. Next slide, please. Here's another picture of some of the ADH workers sitting in the back at the training. That's Randy Roberts, our STD prevention program manager, and a couple of the Ryan White program team. Next slide, please. So looking at best practices, what was key in this is planning, and more planning. That was very important. Delegation is key. It's very, very important to select a strong team lead. Alessa Hamilton is our HIV prevention trainer, and she did an amazing job planning this event. It takes someone very strong to handle out, to control the event. It's a 2-week event. You have to make sure that the area is controlled as far as temperature. We had to monitor to make sure the individuals did not come into the tent, make sure that security was present. So we had to pay vendors to provide security for the event. It was just a massive event. Also, to involve other programs and organizations, it was key that we involved, again, not just the HIV prevention and the hepatitis C team, but we involved the Ryan White, our HIV prevention team, disease intervention specialists, our program nurses, and also content experts. Next slide, please. Here's a picture. This is one of the, like I said, this is one of the most important things in this event was the event planning prior to. So this is, and I don't know how well you can see the picture, but this is directions from Alessa, making sure that everyone knows what to do and where to go. So there was no question as to what individuals were supposed to do at the event because they were given clear instructions. Next slide, please. Three people. There were 82,292 impressions. And this is from our ad campaign that we ran during the state fair and prior to the state fair. So we thought that the campaign was really successful. We had ads on the radio, we had a couple of ads on the TV, and we had the signs posted all over the Little Rock area. Next slide, please. So some of the challenges that we face, with any event, there are always challenges. We missed a lot of time lost with our agency approval of the event. An event of this magnitude was something that the agency wasn't really sure that they wanted to approve, but we pushed back and they agreed to allow us to have it. Thank you, Dr. Bedell. The fair committee would not allow us to do testing on the grounds of the health fair, so that was another one of the challenges, and we had to have the offset off-site testing event at the Compassion Center. We were also not allowed to test on the Fairground the following year. Another challenge was we did have repeat testers. There were individuals that came in to get tested, and they would go outside. Some of them would change the T-shirt or put on a hoodie. And we had to monitor them very closely to make sure that we did not skew our numbers, because each individual was only supposed to be tested one time. We were also unable to control the weather. We got quite a bit of rain during that time, and our staff was really cold. Our feet were wet. But that was just one of the challenges, and something that we can plan more efficiently for next year. Next slide, please. So thinking about the successes of the event, there was a collaborative effort that included all grantees and several community connectors. We tested over 400 individuals for HIV, gonorrhea, and chlamydia. We identified 2 new HIV positives, and we successfully tested 200 individuals for hepatitis C and found 45 positives. Now, if you're wondering why the hepatitis C numbers are lower than HIV numbers, it's simply because we ran out of tests. We did not imagine, I think we set a goal for 150 individuals, and we surpassed our goal. We tested over 400 people for HIV, gonorrhea, chlamydia, and we capped out with 200 individuals for hepatitis C. That's as much as the HIV if we had enough hepatitis C test kits. Next slide, please. So next step, the Arkansas Department of Health is to develop a hepatitis C. The grantees, they are better community developers and future builders. They're funded with the hepatitis C funds from CDC, and also on another secure location for testing for the 2019 test event, because the fair has stated to us. Next slide, please. So in conclusion, although HIV and hepatitis C are different, it is important to prioritize hepatitis C outreach efforts in the same manner as HIV prevention efforts. There are still challenges to hepatitis C testing, linkage, and care. However, the infectious disease branch has developed collaborative, innovative strategies that have increased awareness for hepatitis C and the number of individuals who are tested for hepatitis C in Arkansas. Thank you.
Great, thanks for that, Courtney. It's nice to know too that you have a forecast for 2019 and you can adapt and have more test kits and everything as needed. So we might have to pick your brain a little bit later after the 2019 event and see how that went. I am going to pass it to Jane from HBI DC. And Jane, the floor is yours.
Okay. Hi, everyone. My name is Jane Pan. I'm with HBI DC. For those of you who's not familiar with us, we're next slide, please. Next slide, please. Yeah. Okay, we are a nonprofit organization, and our mission is to mobilize communities to prevent liver diseases caused by viral hepatitis. And our vision is a world free from liver diseases caused by viral hepatitis. Next slide, please. So what we do, we educate and outreach to the at-risk and underserved communities. And then we also empower the impacted communities by partnering with the civic leaders, other nonprofit organizations, government agencies, and faith-based organizations. And eliminate, hopefully, viral hepatitis by providing hepatitis B and hepatitis C screenings and hepatitis B vaccinations, and refer those tested positive to appropriate care. Next slide, please. So this is our usual outreach method is and our accomplishment for 2018 is we educated over 4,600 in-person education for viral hepatitis, and then we screened over 1,900 hepatitis B individuals, hepatitis B, and 5% tested positive, and we linked them to appropriate care. And 43% the screen population needed the hepatitis B vaccination. And we screened over 2,200 HCV, hepatitis C, and 2% tested positive for the hepatitis C antibody, and we usually do rapid testing. But we are able to do 100% of the confirmatory test because we do a blood draw for our HBV test already. So when the rapid HCV test is positive, then we just mark on the lab slip for the HCV RNA PCR. And 43% of that 2% is a load is with a high viral load. In some states, in DC, we because part of our funding is from HIV, and so we have to do HIV testing. So we were able to test 621 HIV testing, and 3 of those individuals tested positive, and but 1 person is co-infected with hepatitis B. Next slide, please. So by no means to get all that done, it's an easy task, as everyone here probably know. So we did 81 events in 2018. Usually it's 20 over 50 events that we do, but last year, because of the thinking outside of the box, as you will see in my next slide, then we did above and beyond. We did 81 events. So we did it at the churches, temples, community centers, health fairs, festivals, parades, mobile unit nail salon, automobile services, and this is all across DC, Maryland, and Virginia area. And there were 97 different countries that was listed in our registration form, but mostly people are from Vietnam, China, India, Mongolia, Cambodia, and Ghana, Nigerian, Cameroon, Sierra Leone, or Liberia, just to name a few. And in 2018, we did 9 mobile outreach screenings. Next slide, please. So thinking outside the box, what can we do more? So in 2018, we want to use the mobile unit approach, and it's a pilot project. It's funded by Mayor's Office of Asian Pacific Islanders Affairs. And so we were doing venue and street outreach, doing door-to-door outreach, and that's an alternative method for screening individuals with limited time to take off from work. We visited many restaurants, nail salons, convenience stores, and auto body shops, primarily with the intention to offer the services to the workers. However, we found out that some customers at the stores also were interested, and so we screened them too. Next slide, please. So how do we decide where to go? So we got a map from the mayor's office, and in DC, like, it's divided into different wards, and so these are the Asian American and Pacific Islanders populations. So we particularly focus on the wards that's with the higher number. Next slide, please. And so this is only the outreach and the awareness. So we will go to the stores and then just to give them the hepatitis health literacy information. And these are the wards that we visited. And as you see, we have a lot more work to do. Next slide, please. So there were many challenges and barriers, and mainly what we had to face is a lot of the people don't know about hepatitis. And when we mentioned to them, then they would say, no, I'm fine. I don't need help. I don't want to get screened, and no news is good news. Another barrier that we have was like building trust with them. So they see us coming into the store and they don't know who we are. And so, they tell us to no, we're not interested. It's one of the, another solicitor, and sometimes, so we rented a van. We don't, because it's a pilot project, we didn't want to invest in a permanent van. So we rent a van, and then we put magnet signs outside of the van. So some people are not really comfortable seeing that the van is really, really not legitimate looking. And so we found that, that people are not comfortable. And then also the weather conditions is not good. And also parking is really difficult. In DC. So those are the few difficult things but how to overcome that. So we have to give them something when they're not fully aware of the virus. So we have to give them something really quick. And instead of a 8x12 paper, we just create a postcard, which is a picture postcard, which they don't have to read a lot, but then we also revisit a place, a venue at the same time, revisit the same place over time. Sometimes we have to go to a place like 3 or 4 or 5 times because they'll tell us the manager is not there, the owner's not there, and then they will have to check with another person. And so that's another really problem. So before we did the van testing, the mobile unit testing, we actually had gone on site and to bring our phlebotomists with us. And a lot of the time, because the space is very small in the store, so they'll tell us, oh, we don't have room, So then we started giving them a lab slip. And then we found that we give out 10 lab slips, maybe 2 people will show up. And then, a lab slip to get drawn in the lab. And 2 people will show up. Then we started to give them a lab slip, but also try to make an appointment for them in the lab, on their day off. So 4 people will show up. And so that's why we thought of getting the van. But then now that we have the van, they started, because we've been there so many times in some places, that they will actually let us go inside the store to set up, we could be in the closet, we could be at the back, just to set up the blood drawn, Also, we found how helpful is when we go to the store that we will mention one of the trusted community doctor. There are a few doctors that's well known in their community that we know of. Then we would say, oh, Dr. So-and-so is also very, will test everybody, and they're working with us. And so they will agree, And then also we partner with respected community leaders, and we will go in with them, with the community, one of the respected community leader. And we found that that's helpful too. But once we have build the trust with the business, and they oftentimes, when we ask, they will refer us to different businesses. Next slide, please. So for the mobile unit in 2018, we did 9 outreach. 9 screening events. We did a lot of outreach. But the actual screening event, we did 9. And then we were able to screen 144 with the individuals for B and C. 9% tested positive for hepatitis B, and 1.4% tested positive for hepatitis C, and 1 tested positive for HIV, and then one person was co-infected. So, with the small number and the 9 positive for Hep B, that tells a lot, So, and mostly, most of the people that's positive, they actually not aware. They're so busy working that they're not aware. So that's why we continue with the second year, the mobile unit, the pilot project. And then I think we're going to do a 3rd year too, because I think with the 3-year data, we'll be able to analyze it a little better if this method of outreach is effective or not. Next slide, please. And out of that 144, 58 people needed vaccination. And the 16 that's positive, we were linking to them to care. So a couple of the success story with the mobile unit was one car repair shop. Initially, the owner did not want us to go there, but because one of our outreach person has his work done in this car repair shop, and they know each other, so they allowed us to go in to get tested, to test the staff, and I think they have maybe about 8 or 9 people working there. And one tested positive for C, who's the owner. The owner is very young, maybe 30 some years old, but he didn't know. He was really surprised to find out that he was tested positive, and he had no idea where he got it from. And then one of the staff tested positive for B, and both of them did not have insurance, and so we linked them to care. And then the owners actually is cured now. And then, and we were also able to screen their members, the family members. And so the owner is so grateful that that he allowed us to go back to his shop in the waiting room. And then he will offer his customer 25% discount to the customer who's willing to get screened with us. So that's one of the success stories. The other success story that we had a random person stop by our booth in one of the community events, and she kind of knew she was HIV positive, but then she thought it's gone away. But then we through talking to her about hepatitis B, hepatitis C, and all that, so she agreed to get tested. And then she found out she's positive for HIV and Hep B, and his doctor did not test him for Hep B, and so he's now, we linked him to care, and then now he's back on treatment, and so she was very, very grateful for that, and this is it. This is all I have. Thank you.
Jane, thanks so much for sharing. 81 events in 2018 is definitely a busy year, and I'm sure you're off to a strong start in 2019 as well.
Yes.
I also think it just definitely, it's on repeat between our presenters, and I'm sure Wayne will have more to share on this, but just the storytelling where you have to build a foundation of trust and build that rapport. So I'm going to turn it to Wayne so he can speak to his partnership models and how he's doing that as well.
Well, good afternoon, and this is Wayne Smith. I'm with Central Baptist Church of Bearden in Knoxville, Tennessee. We have a ministry there called Samaritan Ministry that's been doing HIV work in the community for about 25 years. And so when I saw the topic and the information about this webinar, I just wanted to look at some of the partnership issues, some of the things that we've seen and learned because of mistakes, mostly, in building partnerships within our community. So the first thing that I felt like it was important to say was that it's important for diverse groups of people to sit at the table. That was an early learning experience for us, where when we showed up at HIV trainings and events, we were usually the only faith-based group there. And that surprised people, and we learned it was not important for us to say anything, but very important for us to be present and to be a part of the group. And I think that mop flops both ways. I think if you're a community-based group and you're wanting to do outreach into the faith community, the same rules apply. It's important that you show up and sit at the table and be a part of what's going on in the community. Next slide. So this is a model that we have developed over a period of years, just taking a look at how this partnership and relationship building works. We've already heard from some of our panelists how important it is to take time and to build trust. That's a process. We don't show up at somebody's door and convince them to let us come in and do testing or to help them in any other way. Trust building and relationship building is important. I've mentioned how important it is to show up. One of the things we learned is that it's important to figure out what the existing programs are and offer to help and be a part of those efforts as a way of building relationships with other organizations. It's not always necessary to be in charge and to be the one running the program, but lots of our CBOs around the country need help from other groups and volunteers. For us, partnering with secular groups turned out to be very important, because when we were talking, we're an HIV service organization, so in looking at HIV, there certainly weren't any other faith-based organizations in our community that we could partner with. So that left the not-for-profits and the government agencies like health departments, and that's what we've been doing. That's how we started out, was partnering with secular groups, and some of those are surprising partnerships, and I'll talk about that as well. Many of you know that ministering to physical need is a way to build relationships with people, and we have certainly found that to be true with housing and food, medical appointments, transportation, and all of those issues, that once we begin to help people and help other agencies with those kinds of needs, then they begin becoming curious about where we fit in and how an organization like ours what our niche is in the whole process and in the scheme of getting people into care. And it probably goes without saying, but I'm going to say it, and that is we don't preach and we don't judge people. Next slide. So a few years ago, I was able to talk with someone about two partnership models that I want to share with you for a few minutes today. And these come from some really interesting writing by Paul Hebert. The first partnership model is called bounded set. And the question that people ask if they're using this model is, do you believe what I believe? So for faith-based organizations looking to engage the community, this is a problem. Because if you're a member, for example, of a Baptist church in a conservative part of a conservative state, do you believe what I believe will throw up barriers to who you can work with? You're looking for people who agree with you politically and socially and in many other ways to engage with those people. And that's the wrong question. And we have discovered that by making mistakes, of course. But on the next slide, we'll see a partnership model that I think makes more sense, and also probably describes what the other panelists have talked about too in their work. So let's look at that slide, please. So in this model, we're looking at the centered set rather than the bounded set. And the question's different. So instead of asking, do you believe what I believe, what we ask here is, do you care about what I care about? And so, we've seen examples of state fairs and variety of places where testing can be done. We've experienced that in East Tennessee as well. And so if we ask questions, do you care about what I care about? An auto mechanic probably cares about people having hepatitis C and being sick. So regardless of what your other goals and values are as an organization, if you can team up around these things that you agree about, that you care about together, that really opens that door up for working with a variety of other kinds of groups. And that seems to have been for us the most successful way to do business. Next slide, please. So I'll give you an example here, and then I'll give you some other examples from our work in East Tennessee. But about 2 years ago, Tennessee passed a law making syringe exchange legal in our state under certain circumstances. And so we decided to be a part of the conversation. We decided to sit at the table and listen. And you'll see from this little graph that there were a variety of numbers of people in different kinds of groups that were talking about this: first responders, our local health department, law enforcement, Positively Living is one of our local CBO organizations. And sitting around this table, we discovered some interesting things. We discovered that, of course, there were no other faith-based partners that were at the table engaging in the conversation. The second thing we discovered was the law in Tennessee prohibits tax dollars to be spent on syringe exchange supplies such as needles and works, tubing, and other kinds of materials for clean syringe exchange. And so when we found that out, lo and behold, it just so happens we would call it a God thing that we were able to secure some grant funding from the MacAIDS Fund so that we could provide financial support to seed Positively Living when they started their syringe exchange program, and also another program in Chattanooga. But had we not been sitting at the table, had we not been listening and been a part of the conversation, we wouldn't have known, and we wouldn't have been able to help. So on the next slide, let me just give you a few examples of some of our most unique partnerships. You can see here that we have a broad base of partners that run the gamut in our community, from government, not-for-profits, churches here in the community. And we value all of these partnerships, and we're a very small agency. We can't do our work without the cooperation and the assistance of our community. Next slide. So our most unique partnerships, we have a great partnership with an organization called Helen Ross McNabb Center. Helen Ross McNabb is a large mental health organization in Knoxville. It's one of our largest not-for-profits in the city. And when we began doing HIV and hepatitis C tests, we had a challenge that we didn't have a CLIA waiver or license to do testing. And our friends at Helen Ross McNabb suggested that we form a partnership. We wrote an MOU, and when we do testing in our community, we do that under the umbrella of the CLIA waiver for Helen Ross McNabb Center. We're not a faith-based organization. We don't have similar value statements as organizations, but there's an awful lot that we agree on in terms of how we can serve our community. We also have great partnerships with the Tennessee Department of Health. I'm one of the 2 state trainers for hepatitis C and hepatitis C testing in Tennessee. So who would think that a minister from a local Baptist church would be one of the trainers for the Tennessee Department of Health? A great partnership. And then one of those that stands out to me is our partnership with Planned Parenthood. You know, there's a lot of talk about defunding Planned Parenthood, and there's a lot of conservative groups that are trying to do that. And so for a Baptist church in East Tennessee to have a partnership with Planned Parenthood, certainly it's something we don't talk a lot about because it would raise some eyebrows. But what we agree on with Planned Parenthood is that there needs to be more condom distribution in our community, and they help us with that. And they also provide volunteers and staff people to help us with our testing programs out in the community. For example, in a couple of weeks, we have a team going out on tomato farms. We do this through July and August. Rural tomato farms with migrant farm workers to do HIV and hepatitis C testing, and Planned Parenthood is one of our testing partners for that event. So I would just challenge all of you to look at unique ways to form partnerships. And the main thing is when you find out that there's someone talking or doing something about something that you care about, might be a good idea if you showed up. And that's what I have today. Be glad to answer any questions when we have our question time, or we'll refer you to our website that's here on this slide. Thank you very much.
Excellent. Thank you, Wayne. I think it's pretty common for all of us to have an idea of who ideally we want the key players to be at the table, but it's pretty rare that we sit at the same table. So this is a very interesting to see it all come together. So thanks for speaking to that. I do think we will open it up for questions and answers. So we have the chat box, we have the question box for all attendees on the line. If you want to channel your questions through those, I will turn it back to Alyssa now and we can get the questions started.
Great. Thank you so much, Jasmine, and to all of our speakers. I'm always impressed when I hear about the work you are doing, and I'm excited when I learn new things. I feel like every time I talk to you all, there's something different. So Wayne, I feel like the testing on the tomato farm is a really cool and important program that I didn't even realize you were doing. So thank you for all of that. I have a couple of questions to start with, but I know I've seen a few come in as well. So wanted to get to those first, and then continue to share any questions or that you have, or if you are doing things in your program or in your work or testing in certain sites or want to explore certain venues, please feel free to share that as well. So the first question, actually the first two questions came in for Jane, so I'll ask them in two parts, but just to kind of cue you up, Jane, and be ready. But Shari from the foundation was asking about how she said that their experience at festivals and fairs, they've had a hard time recruiting people, particularly when there's a lot going on and people are there, their families, and they're playing games and a range of other things. Do you have any advice in terms of what's worked in recruiting people in some of those event settings? And I guess Courtney as well can speak to that from the state fair, but just any advice on how to recruit people at outreach settings where there's a lot of other stuff happening.
Right. Thank you for the questions, and it is not easy. So we don't really like to go to picnics, especially this summertime right now. People always ask us to go to, they have a picnic event, all the churches members are there. And they don't really like to get tested, And so what we try to do is to give them an education ahead of time, and tell them that we will be at the event. And so that's one thing that we do. And then another thing that we try to do is to just keep giving out postcards. We found that, the postcards is kind of effective and something small for them to take with them. And so that, but it's really not easy. It's really difficult. So if you're having a hard time, it is difficult.
Thank you. And one thing that came to mind, Courtney, I'd love to hear your thoughts, but I think, not testing on the fairgrounds, at first seemed like a challenge, but you got creative about how to connect with people off-site nearby and promote it through the fair. So I'm curious if you think that was part of the success in your having it connected with the fair, but it's not there where people might not be as motivated to get testing, or any other recommendations about recruiting people and getting them engaged.
I think the fact that we had the testing event in conjunction with the health fair, with the state fair, was a huge part of our success. We also tried to make sure that we include hepatitis C as an integral part of the HIV prevention planning group. So in order for us to ask and to solicit volunteers from the planning body, we make sure that we include hepatitis C. So we were able to garner the support from the HIV planning group, as well as the funded hepatitis C and non-funded grantees. I think that was really huge, just kind of including everyone and making it a collective event.
This is Wayne. I have a suggestion there as well. We found that a lot of times if we're doing testing events, uh, the organizers often want to put us off in a corner somewhere. And if we're out, because of privacy, which makes sense. But I have encouraged organizers to let us be right in the middle of the thick of things, especially at a health fair. If it's blood pressure and hepatitis A vaccines and blood sugar, then HIV and Hep C is right there, and the next table right in the row. Because when we're secluded off somewhere, then people won't seek us out, and it draws attention to they're getting that tested. They have to go seek that out. So we found that doubled probably all of our participation when we got ourselves located in the mainstream of what was happening at those kind of events.
Great, thanks so much, Wayne. And do you also mind, I mean, you don't have to share if it's still something that works, but I know you've thought about or considering doing this at national conferences as well. Do you mind sharing a little bit about that?
No, we participate in the U.S. Conference on AIDS each year, and when we exhibit, we have a table and a booth. And most years, and we've been doing this, I think, 2004. Most years, we're the only faith-based organization in the exhibit hall, so we get a lot of attention. And this year in DC, and I may need some help from some of the other panelists to pull this off, but we're hoping at USCA this year, we've already gotten permission from the organizers to do hepatitis C testing inside the conference at our table in the exhibit hall. And we have a couple of challenges. We need a local DC partner with a regulator to help us do that legally. And then the other thing we're hoping to do is on a couple of afternoons late toward the end of the day is to do some Narcan training. And we would like to provide Narcan kits part of that training, but we need a partner to help us with that because we haven't been able to locate kits that we can use. So those are a couple of new outreach efforts that we're trying at the United States Conference on AIDS. And of course, if we can pull it off, it might be a model for others to use as well.
Great, thanks, Wayne. So we'll definitely all follow up on the line, or if anyone else has ideas about that, feel free to reach out because we'd love to see that happen. And then a couple more questions came in. I just want to note that we can share contact information and are sending out the slides as well. So I know some folks want to reach out directly and we'll connect after the call. But I have a couple more questions I want to make sure we have time to answer. So one came in from Blossom from NASTAD about how she was curious how Samaritan Ministry got buy-in from leadership in your congregation to pursue hepatitis and HIV testing. And if there are any things that would be helpful as we're thinking about expanding relationships with faith-based communities and partners.
It's a great question. First of all, it was a slow process. We were able to secure interest in HIV because of a book actually that was written in the late 80s, early 90s, I guess it was, by a Baptist minister from Texas who had HIV in his family, a gay son, and his other son's wife, his daughter-in-law, and grandsons that were infected with HIV. And this was in the early 80s, and there wasn't anything to do. And so this book was pretty popular story during the early 90s. And one of the ministers of our church read the book and decided we needed to do something to learn more about HIV and to take some action. So I'm not sure that's a process that can be replicated, but we have just found that talking about serving people who are sick resonates. Talking about following the model of Jesus to heal the sick and visit people in prison and those kind of things resonates. We have social justice issues that are people are talking about these days around incarceration and around the Narcan problem and injection drug use, and those are just opportunities to engage churches because like I said before, when I talked about the centered set model, we can certainly say, even though we might be from different, look at these epidemics from different viewpoints and have different kinds of organizations, there are common themes that that we can care about. In Knox County, one person dies of an overdose every day. And so there can't be a church in our city that would not be concerned about that.
Great, thanks, Wayne. And I think that point is replicable. You know, you spoke to the book that was written in that story, but we talk a lot about finding champions within certain communities that can share that message and engage. And so that, I think, is a great example of a champion who was able to build that support within your community. So thank you. I have a couple more questions and not a lot of time, but I did want to also mention Kelly Reinhart from the Addiction Technology Transfer Center Network shared that some of the work that they're doing and will be producing resources on is focused on expanding testing and opioid treatment programs. So I know that's a big area of interest, and somewhere outside of the clinic, a lot of you are working to engage and strengthen partnerships. So we'll be sure through this coalition to share out those resources as they're available. But one more question that came in for Jane. Jane, how do you determine locations and times for the mobile units and going to the communities, and do you update them throughout the year, and how do you just navigate that process of seeing what works and making changes to reach the communities that you're going out with the mobile unit to?
This is a great question, because we have a hard time dealing with that, because we do the outreach during the weekdays, knowing that they're not that busy, and so there's only 2 or 3 people at the shop. You know, this I'm talking about particularly at the nail salons, and so there's only 2 or 3 people at the nail salon shop. You know, and then so they'll tell us to come back on the weekend. You know. When there's more people, but then we will go back on the weekends. Then they're too busy to see us, you know. And so what we found that we had to do is we have to go back a couple of times in one place. You know, one time we might just get 5 people, and the second time we might get 3 people. And so because some nail salon has got like 20, 30 technicians working there, you know. So that's what we have. And restaurant is the same thing. Restaurants during their busy hours, we can't go there. During not their busy hours, then we can't talk to, there's not too many people we can talk to, you know. And so like we have to go there at different times of the week, different times of the day, you know. Yeah.
Great, thank you. So I realize we only have a couple more minutes left, and I have longer questions than I think would be able to fill in that time. So I just wanted to see, are there any last minute closing thoughts that you'd like to share, or recommendations for folks as they're thinking about new places or new partners to engage to expand testing and linkage to care in their work?
This is Courtney, and my advice would be really simple. If you build it, they will come. We didn't prepare for the number of individuals that came out to get tested, but if you offer the resources, they will come and take advantage of it.
Great, thanks, Courtney. Wayne or Jane, any last minute recommendations or words of wisdom from your experience?
I would just say that I think all of us, probably all 3 of us, have been surprised at the willingness of people in our community to help and participate and partner when we ask them. And so I think it's just a challenge, but it's also an opportunity.
Great, thank you.
So I would say that we are like the everlasting battery that we have to just keep on going, you know. And sometimes we will get a lot of people to get screened, and sometimes we won't. But in the long haul, it all work out.
Great. Well, I want to thank you all for your presentations. I know I took a lot. I think the key themes for me that showed up were partnerships, creativity, giving things a try and updating, and just a lot of really important ideas for how to build partnerships with folks who have similar goals and the same mission that we might not think about initially. And so I'm excited to process this more and think about how this will come back to my work. But I appreciate you all sharing, and then everyone for joining today. I wanted to just note, as I mentioned in the beginning, that there's going to be an evaluation that pops up at the end of the webinar, and we'll be sending one out as well with a recording of the webinar and the slides, and that's an opportunity to share what other topics you'd like to see covered through this group. And I do see a couple more presentations or questions coming in, so there might be some follow-up in that email as well. But thank you all again so much for joining, and I hope you can join one of our future hepatitis testing partnership webinars, and we look forward to thinking about additional creative ways that we can increase testing and linkage to care. So have a great afternoon, and hope to talk to you all soon.
Thank you. Thank you.
Thank you.
Thank you. Thank you.